Hi, this is Marty Jordan. This is my second attempt to record this because I did something to my database and deleted it and freaked out. And so here we go. But what we're supposed to do for this part three, we were supposed to develop four different types of users. So what I chose to do was develop an administrator user, a data backup user, a programmer, and someone who could just review recent things because we're supposed to um, present this project to a health board so that we can use it for what I assume would be population health management. And so um, the reason I chose those four is because a database administrator, is kind of responsible for the overall management of the data project. They are the ones that are responsible for policies, procedures, standards, planning and development of the organizations, um, and kind of working together with um, the the organization, um, and the people who have the data. Um, so they're going to work together to help with conflict resolution, help with data analysis, the rules of business, the operational requirements, and the corporate, help define the terms so everybody's working from the same perspective, and then marketing, and then managing. Um, and then I wanted to have somebody who was able to back up the data, um, because that person doesn't need to have as many privileges. So that person would there, and then a root user who is a supervisor. So this person's going to have full privileges to write, read, and execute things. They can create and or install files, modify files. You can really give them any kind of privileges you want. You can limit their privileges, or you can give them more privileges, um, because I think you really need to have that kind of person to help you troubleshoot things. And then I wanted somebody to be able to back up the database as needed. They don't need um, the necessary privileges. And then if we're going to be working with an outside agency, we need somebody who can we need to grant them privileges to view recent information, but not the whole entire database of our patients we've been seeing for years and years and years. So I am going to run the script and pray that it runs again, which it did the first time. And then I'll show you the scripts that I use to write for the users. Oh no. It's given me an error code again. Okay. Somehow I did something wrong. I had it all written out, and let me go up here and see if the way I corrected it. Nope, it's not working. Well, so I will show you the script, and I'm disappointed, and I'm sure that this, it was all fixed. I went to the university and had someone at the computer science department help me, and it was all fixed when I left there. And he assured me that it would be fixed when I got home, and it's not. So we created, I created user one, identified them, granted them all user administrative data on all the tables, the DM, regular, demographics, glycemic, the risk management, the microvascular, and then you show them your privileges. This was how I created the user program, the user for the program, user 3 for programmer. Um, and then here's the script I wrote for the programmer. And And then here's the one I wrote to show view recent. And then there's the one for data backup. And like I said, when I left the university this last time, it was working and I had 179 rows. And I don't know, but I'm so frustrated because I worked so hard this semester on this and had this entire project. But oh well, life goes on, doesn't it? So um, now I'm going to pretend I've left my office and I'm going to talk to the health board and I'm going to review my database with them. So what the original project was for, I am a provider of diabetes care, and healthcare reform has come in, and we are tasked with providing diabetes care for, according to patient population management. And so when you do population management, you want to base it on health outcomes. And so you want to manage diabetes according to standards of care, and standards of care that are according to the American Diabetes Association. You want to look at patients um, according to certain health outcomes. And with diabetics, you want to know things like their BMI, if they've ever had diabetes education, if they've ever had activity education, what their A1C level is. Um, you want to know the meds they're on. You want to know what their LDL cholesterol is. Are they taking aspirin? What their blood pressure. There's certain guidelines that you want to have their blood pressure. You want to know if they're using tobacco and you want to encourage them to stop. You want them all to be on a statin. You want to know what their HDL is because you can monitor um, health outcomes by that. It's important that they're on an ACE inhibitor if they can tolerate that, or an ARB, which is an angiotensin blocker, because that protects their kidneys. You want to make sure everybody has a foot exam every year with a monofilament exam, because uncontrolled diabetes causes you to have changes in your foot, and so then you have nerve changes and you don't feel, and then you step on something and then you have an amputation. And um, the evidence shows that usually if you've had one amputation, you have another one within 18 months, and then within the next 18 months, a lot of people are dead. And then you want to do an eye exam because that can look at your microvascular system, because when you have retinopathy in the back of your eye, you can also have small vessel disease, and it can also tell you kind of how your kidneys look. And so you also test urine microalbumin to test that. So I'm giving you an example here of 20 patients. This is just for purely for today's presentation. And here's the patients with their date of birth and their initials, because we're trying to protect HIPAA. So we're identifying them by sex, date of birth, and initials for right now. And then I created a table with their risk management. So this says if this is their LDL levels. So you want your LDL cholesterol for a patient that has diabetes to be the normal LDL levels under 130. So you really want them to be on a statin, and then if they've had a cardiovascular incident, you want it to be under 70. We're not doing too well with our patients here right now, but this was the first measurement. Some of them we're doing well with. You want them to be on aspirin therapy. You want their blood pressure. The new guidelines are 140, under 140 over 90. Some of these patients, we're getting there. We're starting them on the ACE inhibitor or the ARB. So hopefully at the next visit, we'll see that. We're asking them questions. Are you on to use tobacco or not? And also now the recommendations are about vaping. So we're asking them about that. We're asking them if they're on a statin. we're asking them, have they already been placed on an ACE or an ARB? And then we assess their HDL level. Usually with diabetics and people with metabolic disorder, we see that their HDL levels are low because that's part of the metabolic disorder. And then when you talk to them about exercise and you start correcting their disorder, you can see the HDL levels rise. We also have done a table here about glycemic control. And so you want to know what their BMI is. And so then you can look at their levels of BMI. If it's under 30 but above 25, they're overweight. If it's above 30, they're overweight. If it's above 36, 37, I think it's morbidly obese, and that affects the level of insulin resistance in the body, and that affects how well we can control their diabetes. We need to know if they've had diet education every year, yes or no. Activity education, yes or no. The American Heart Association recommends people have 150 minutes every week, so we can talk to them about that. We need to know what their A1C level is. The American Diabetes Association recommends it be below 7. The American Association of Clinical Endocrinologists recommends below 6.5. So what we do is we start them on medicine. Everybody needs to be on metformin if their kidneys are okay. And then if they don't get better control within 3 months, we start them on another medicine, check their A1C in 3 months. If it's not lower than that, we would go up. But this is why we check this. Whenever we first see the patient, we ask them how many meds they're on, and then we can actually start adding medicines. There's guidelines that you can follow to add medicines. Microvascular end organ disease, you would do this on a patient every year. You would want to do a foot exam, a dilated eye exam, and a urine microalbumin. This helps you follow to check for their microvascular disease. You would want to, this is just a table that we did to see what the difference in women and men are on their A1Cs. And then this was comparing their A1C level for who was less than 6.5. Every year a patient gets, every 10 years they age, they usually have less glycemic control just because our pancreas works less. If you're overweight or obese, you have insulin resistance. So having a database is essential because it's going to help you have a snapshot of the patients. It's going to help you be able to follow them. You're going to be able to do research on it. You're going to be able to do in order to do population health management, you're going to need to be able to do big data sets and do research that way. I think back when I first started doing diabetes management, which was in the 1990s, we have the Diabetes Control and Complications Trial, which I think was in 1993. They had almost 6,000 patients in that study, and then the UK PDS trial was almost 8,000 patients. And that, I mean, we have volumes of data now. We have patients where we could have 10,000 patients in a set. And that's the way we're going to do population health management, and that's how reimbursement's going to go. So today I've just presented a small data set of 20 patients, but with database development, we can have, like I said, thousands of patients, and we actually, if you have your patients that have been coming to the clinic, we can have 20 years worth of data, and we can do longitudinal studies with databases. So I will be here after my presentation, and I'll have my business card. If you have any questions, please don't hesitate to come up, and I will talk to you. And also my staff will be here with me, and we can talk to you about setting up the database and the different user levels. Thank you for coming today.